Yo, Europe's in deep trouble right now. A disease we thought we'd kicked to the curb ages ago is back with a vengeance. It's measles, and it's tearing through communities, hitting a 25-year high with cases piling up like never before. Measles is like the ultimate contagious nightmare. One kid with it can infect up to 18 others just by coughing or sneezing, way worse than the flu or even COVID. In 2024, Europe got slammed with 127,350 cases, double what they had in 2023, and the worst since 1997. Romania is the epicenter, with over 30,000 cases, nearly half of them kids under 5. This isn't just some random spike, it's a full-blown crisis driven by years of dropping vaccine rates and misinformation. Families are scared, hospitals are packed, and communities are reeling from a disease we know how to stop. We've got a vaccine that's basically a silver bullet for measles. Safe, effective, and around since the 60s. 2 doses, and you're golden. But here's the crazy part. People aren't getting it. In Romania, only 62% of folks are fully vaccinated when you need 95% to shut this virus down. Bosnia and Montenegro, under 70%. What's going on? It's a toxic mix of online myths, anti-vax influencers spreading lies, and healthcare systems that can't reach everyone. Back in the early 2000s, Europe was on track to wipe out measles, but vaccine hesitancy started creeping in, fueled by debunked claims like the autism scare. Now we're paying the price. Kids are getting sick, and communities are stuck in a preventable mess. Don't let anyone tell you measles is just a kid's bug. It's a straight-up killer. In 2024, 38 people in Europe died, mostly little kids who didn't have to go through this. Measles can hit you with pneumonia, swell your brain to the point of permanent damage, or even blind you. And get this, it screws up your immune system for years, like hitting a reset button that makes you vulnerable to every germ out there. Over half the cases, think 60,000 plus people, needed hospital care, clogging up ICUs and burning out healthcare workers. This isn't just a health scare. It's a tragedy that's ripping families apart and costing millions to manage. Measles laughs at borders. In 2024, the world saw 359,521 cases, and Europe's 127,350 were just a chunk of that. This virus loves to travel. Someone unvaccinated from a hotspot like Central Asia or Africa can hop on a plane and bring measles to Paris, London, or Berlin in hours. By 2025, 53 European countries had cases, from Spain's sunny coasts to Sweden's snowy towns. The math is brutal. Measles has an R0 of 12 to 18, meaning it spreads way faster than most viruses. One unvaccinated tourist or migrant in a low-vax community can light a match that burns through schools, daycares, and neighborhoods. Global trade and cheap flights are making this a worldwide problem, not just Europe's headache. Misinformation is the gasoline on this fire. Social media is a minefield. Anti-vax influencers, fake studies, and viral posts claiming vaccines cause everything from autism to infertility. Spoiler, those claims are total garbage, debunked by decades of data. But in Romania, where only 62% are vaccinated, people are eating it up. Mixed messages from health officials, a history of medical scandals, and a stretched thin healthcare system make it worse. Parents are scared, and who can blame them? When you're bombarded with lies, it's hard to know what's real. The result? Whole communities of unvaccinated kids, turning schools and playgrounds into measles breeding grounds. This isn't just a health fail, it's a societal breakdown that's putting everyone at risk. The measles vaccine is a freaking miracle. 2 doses give you 97% protection, making it one of the best tools we've got. It's been studied for over 50 years, with billions of doses given worldwide. No serious side effects for the vast majority. But here's the gut punch. 22 million kids globally missed their first dose in 2023, and Europe's part of that mess. The COVID pandemic threw everything off. Lockdowns shut down clinics, parents skipped checkups, and supply chains for vaccines got tangled. In Romania, vaccination rates haven't recovered, leaving huge gaps. Every unvaccinated kid is a doorway for measles to waltz right back in, and we're seeing the consequences now with hospitals stretched thin and families in crisis. This outbreak is hitting the underdog hardest, and that's no surprise. In Romania, Roma communities, single parents, and families barely getting by are stuck in a tough spot. Many can't afford a trip to the clinic, don't have access to doctors, or live in areas where healthcare is a pipe dream. During past measles outbreaks, these groups got crushed. Higher infection rates, more deaths, worse outcomes. Why? Poverty, discrimination, and patchy healthcare create perfect conditions for measles to thrive. It's not just a medical issue, it's a justice issue. If we don't get vaccines to every corner of society, we're leaving the most vulnerable to fend for themselves, and that's a failure we all share. The big dogs at the World Health Organization and UNICEF are freaking out, and they're not wrong. Measles cases have been climbing since 2016, and it's not just bad luck. Vaccine hesitancy, fueled by misinformation, plus disruptions from wars, pandemics, and underfunded health systems, have created a perfect storm. WHO says we need 95% vaccination coverage to stop measles, but Europe's nowhere close. They're pushing for more money, think billions, to fix surveillance systems, train doctors, and run catch-up vaccine campaigns. Without it, we're just patching holes in a sinking ship, and measles will keep coming back stronger. Measles is a global pain in the neck, not just Europe's problem. In 2025, the Americas saw a crazy jump, 2,318 cases across 6 countries, 11 times more than 2024. Africa and Asia are getting pounded too, with millions unvaccinated. Why? War, poverty, and weak health systems leave huge gaps. Add in global travel. Think 4 billion plane trips a year, and measles can go from a village in Africa to a subway in London in a day. Low-vax areas are like dry grass waiting for a spark, and one unvaccinated traveler can set it off. This is why we need a worldwide game plan, not just a Europe fix. Smart people are busting their butts to fix this, but it's a tough climb. Scientists are working on new ways to deliver vaccines like patches or nasal sprays to make it easier for folks in remote areas. Groups like Gavi are funneling cash to get shots to poor countries. But here's the deal. It takes billions of dollars and political muscle to pull this off. Right now, global health budgets are stretched thin, and vaccine programs are competing with other crises like climate change and wars. Without serious investment, think $10 billion by 2030, we're just putting band-aids on a broken system, and measles will keep outsmarting us. War and migration are throwing fuel on this fire. Families fleeing conflict or poverty, like in Central Asia or parts of Africa, often can't get vaccines because healthcare is non-existent where they are. These folks move to new places, sometimes carrying measles with them, not because they want to, but because they've got no choice. In Europe, refugee camps and overcrowded cities are hotspots for outbreaks. This isn't just a medical problem, it's a humanitarian one. If we don't get vaccines to every corner of the globe, we're all at risk. Global health security means no one gets left behind, and right now, we're failing that test. We're sitting on a powder keg. In 2023, 500,000 kids in Europe missed their first measles shot. That's 500,000 weak links in our defense. Each one's a chance for measles to take hold and spread like crazy. Hospitals are getting crushed. In Romania, some are turning away non-emergency patients just to handle the measles surge. Doctors are working insane hours, and the cost is racking up. Think hundreds of millions in medical bills, lost wages, and economic hits. This isn't just about sick kids. It's about entire healthcare systems buckling and communities losing trust in the system. We're fighting a war on multiple fronts, and we're not winning yet.